Identifying COVID-19 patients is critically important in being able to give them the best possible treatment and so increase their probability of recovery. So the earlier you identify disease, the better. This is extremely important for the most vulnerable patients, and indeed evidence is suggesting that it is those individuals with underlying conditions who are suffering the most from this epidemic. The standard way in which you identify COVID-19 is via swab test, as we know. The swab test, unfortunately, can take some time in order for you to get an idea of what's going on, in other words, to derive a result. There can also be false negatives. So in other words, it may well be that the test says you don't have COVID-19, but it's clear to the clinicians that you actually do. So we need a plan B, and plan B involves looking at the lungs using x-rays and in particular using CT scans. Using CT scans, we can build up a map, if you like, of what the lung tissue looks like, and trained radiologists can identify the signatures of COVID-19 disease. However, the signatures of COVID-19 disease at the late stage are quite obvious, at the early stage are quite subtle. And so what we're trying to do here is we're trying to build a support system using artificial intelligence techniques that permits a radiologist to take a CT scan from a suspected patient, load it into the system, and to make a call as to whether or not that patient actually is indeed a COVID-19 sufferer. The goal of this project will be an AI system, a trained AI system. A trained AI system on a desktop machine that will be located in a radiology department. This will allow the radiologists to upload a CT scan of a suspected COVID-19 patient and to run it against this trained system. And the trained system will analyze the CT scan given to it and make a call as to whether or not it believes the patient is a COVID-19 sufferer or not. And if it does recognize evidence of COVID-19, it will isolate it on the images. It will then present that information to the radiologist and in a support capacity enable the radiologist to drill in there and make the final clinical decision. We believe the system will be incredibly useful for those patients who have underlying conditions and for whom a clinical diagnosis is absolutely critical in terms of their potential for recovery.